Hi, and welcome to a special episode of our Experiencing Consciousness podcast. We are
Roxanna Erickson,
Catherine Rossi,
and I'm Jan Lipa.
We are so happy you are here.
Hi, and welcome to another episode of our podcast. Today we are here with Dr. Roxanna Erickson-Klein and Dr. Catherine Rossi, and we're going to be talking about the art of observation in psychotherapy. So where do we start with the observation? What's the most important kind of thing?
Well, what I'm curious about, because Roxy's here, and I always have questions to learn more about Erickson. And Erickson had this amazing way that he would ascertain somehow, and I think it was through observation, how that individual learned best. And then he would tailor the way that he would present the therapy according to the way the person learned best. And I wonder, Roxy, do you know what minimal cues he was looking at in order to determine something like that?
Well, I can't say that I know exhaustively or comprehensively, but I know what I think I know. And that is that he rarely, now on the phone it was different, but when somebody approached in person, he would go right into casual conversation. They would be looking, because our home and his office was really almost littered with archaeological, things and interesting things and pieces of art, interesting, unusual, you don't know what this is or what that is. And so he would be looking at the individual, what caught their attention, what caught their eye, are they looking around them? So it was not only visual stimuli that was then detailed, because there was classic artwork, there was indigenous artwork, there was geological stones of various sort, there was a whole array of totally different things. So visually he would be looking at the subject and noticing what it was that they noticed. Okay, so that's one sensory channel. Another sensory channel is we were in a home with other people, and whereas we had some household rules of being respectful and speaking in low tones and being quiet, we had pets, we had dogs, there would be interruptions, there would be the sound of people walking on the hardwood floors, from one room to another. And so from the auditory channel, he would be looking, are they noticing somebody speaking in the other room over there? Are they, are they distracted by a conversation of someone else going on? Do they exhibit a startle when the dog walks in? Do they, does it draw their attention in this way? And he would be carrying on this casual conversation of, and I don't mean talking about the weather. He would never start with talking about the weather or the news or any of the normal conversation starters. He would ask them, he might ask them, did you have any trouble finding the place? Or what, what brings you here today? Or, I see you're wearing, an interesting piece of clothing. Or, so he would be in casual conversation, particularly if he sees, oh, you're looking at this over there, he would say, oh, I see you noticed that. And so he would be using the auditory, channel, as well as the feedback that he's gathering from that to begin to hone in. And then another channel, of course, is the kinesthetic, how posture and the person's, how quickly they're moving or how slow they are moving. Are they right-handed? Are they left? Are they standing tall, or are they hesitating and sitting down every opportunity? So he's making these observations in terms of body position and stature, the way they move, whether the clothes are well-fitting or loose, whether they're jogging clothes or formal clothes. He's making those observations. This is all within the first couple of minutes of laying eyes on somebody. And then he would begin to ask more directive questions. Did you notice I have something over there? And then he might gesture over there, oh, I see you notice the rock specimen behind you. Like here's a salt specimen. I see you notice my salt specimen back there, which is the Himalayan pink salt. Did you notice I have this geological stone over here? Would you like to go and pick that up? So now he's inviting them to walk away from him across the room to look more closely at some rock specimen that's over there. And he is observing, okay, how ready are they to go and do that? Do they bend down? Do they pick it up? Do they touch it? And so all of these are feeding into his observation of the modality that is central to this person's, way of experiencing life. And then, of course, he gives his hunches and then goes on, checking and double checking and reinforcing. Then I myself, my office, and this is my home office. This is not my professional office. My professional office is more standard, modern, clean, I can't bear to have nothing interesting to look at, but I don't have the multitude of things that, you can't really focus in on any one thing that my parents did. But in my office, when someone comes in, I'm listening. I start a conversation, and my conversation generally starts with essentially what brings you here today. And then I'm listening to how they describe, and are they describing in words? Are they, what they see? Are they describing what they're, what somebody said to them? Are they describing, what they're feeling? And how are they interfacing with what they're telling me? Now, all of that, I'm just kind of focusing on the visual, the auditory, the kinesthetic. There is also the emotion part of that, and the responsiveness, and the additional layers of what is being told, what's troubling someone, etc. But that's my starting point, is to start a conversation where I'm listening to what they're saying. I'm inviting them to paint a picture for me, or to tell me a story, or to give me the feeling, or any combination of those as to what they're hoping and expecting is going to take place in the professional relationship. Now, there are some additional layers of this that I can go on with. One of them is that when we were young, well, as a family, we were always encouraged to notice what was going on around us. And we were a medically oriented family. Medicine, health, and illness was something that was really emphasized in our household as being relevant, important, something to strive for, something to be aware of, and and to always be taking care of your physical body as well as your mental health. And one of the things, my dad walked with a cane. He had a very significant limp that was residual from the polio he had as a young adult. And so he didn't do this in front of other people, but in the confines of the family conversation, he would stimulate within us that there is a difference, whatever causes a limp or an unsteady gait or a way of walking, it's really interesting to understand the pathology that leads up to that adaptive process. And so there was never anybody, when we were in the car driving around, and if you'd see somebody on the sidewalk who had, an unusual gait or limp, we would have a dynamite conversation in the car. Well, what is your observation? What are you noticing about the way that fell on the sidewalk? What are you noticing about it? And what do you think the pathology that contributed to that? What do you think? What do you speculate? And then all of us would have our input. It's just an old drunk. And a few too many last night or this morning. Okay. Or no, that looks like somebody who's very weak or whatever. I learned a lot about syphilitic gaits. My mom said that you can, we don't see that anymore. But apparently in the 1930s, there was a lot of people who walked with a syphilitic gait, which was apparently very distinctive. All right. So I became, aware that, well, if somebody had polio, they tend to limp this way. If they're post-stroke, they may be limping in a slightly different way, or if they have spina bifida or some, injury, that it expresses itself in different ways. And so we always looked at that with curiosity and interest, checking our own diagnostic skills and using one another to express our observations in a very respectful way. And I could continue to do that. And in fact, I admit that there is a fellow that I've probably known him 20 years, who walks with crutches, and he has weakness of both his lower limbs. And he was having a conversation with me. It was just last week. And he commented, he said, you know, I can't walk on uneven surfaces because of my polio. And I was like, oh, you had polio? I always thought you had spina bifida, and that's why you walk with those things. And I just out before I realized, oh, that may not have been polite for me to blurt that out in that way. But he turned out like a man. He said, oh no, I had polio when I was a kid, and it left me with this. And in my mind, I'm going, oh, I misdiagnosed that. And why did I miss? You know, not that there is any consequence to me making, you know, an observation that wasn't accurate. But I'm questioning, why did I assume that it was spina bifida and not polio? You know, and I know why I did, but that practicing observational skills, that's the point that I'm trying to make. Practicing the observational skills and having the forum, and this is the value of working with colleagues. If you're all sitting in a room together and have the opportunity to make common observations, and then respectfully, quietly comparing your observations. What did you notice, and what did you discern from them? So I'm going to hush now and let the two of you respond or give your own observational information, and let's move forward.
Well, first of all,
wait. I would actually direct that a bit in a bit broader area, because since you actually discussed some of your own ideas and some of the ideas of your father, Dr. Milton H. Erickson, I wanted to ask Dr. Catherine Rossi to discuss her ideas, but also, since I know that she and Dr. Ernest Rossi were many times working with people, even without words and stuff like that, you know, so there was a lot of process work and kind of like working with the experience of a while with what was going on in the moment. Then my question to you, Dr. Catherine Rossi, would be if you could share some of your ideas, what to pay attention to, but also maybe you know a bit more about that than I do. For example, what Dr. Ernest Rossi was also paying attention to when he was working with clients, you know, what was the important information for him, how he would distinguish where he was in the process. Maybe we can also share a bit about how to distinguish which stage of the 4-stage creative process there is in this particular segment, that someone is, you know, maybe someone is doing something that is distinctive of particular stage or something, you know. These are the ideas that are like fluctuating in my mind right now.
Well, first of all, I want to thank you, Roxy. That was absolutely fascinating and really, really thorough. And I learned some new things, and also it's going to enhance my observational abilities. And this is my office that you're looking at. It's my office in my home library, where I see people, and there are a lot of artifacts around, and there are a lot of books. And I pay attention when people come in of what they're looking at. And you know, that often they'll go to a book, I know this book, you know, that sort of thing. And only occasionally will they speak about the art that's here, and or the geological things, or you know, various sculptural sorts of things, you know. And there are some of the wood pieces that Erickson gave to Ernie. So there's various things around here. There's a carved Inuit whalebone that has many faces, and I mean, it's an exquisite piece of art. And upon occasion, and it's huge, and upon occasion people will notice that, but how often they don't, which is really a surprise to me. So my mind is swimming with how I can become even better at observing as a result of listening to how the careful observation that that your father and your mother were involved with, and how they gave an opportunity for you to come to your own mind with it. And particularly interesting and appropriate, these medical diagnoses that in looking at a person's posture. So I have a lot to think about, and I'm excited to improve my observational skills, which are pretty good, but now they can be better. So, Jan, to get to your question. So when someone telephones these days, that's generally how someone will make an appointment. Sometimes it's via email, but it's usually by the telephone. I'm listening to their voice very carefully. I'm listening to the voice volume. I'm listening to the rate of speech. I'm listening to when there's hesitation. I'm very, very sensitive to a person's voice. Is their speech pressured? Is their speech kind of slow? So I'm getting an idea of who it is that's going to be walking through the door as a result of their speech, how they talk. And that was also what my dissertation was about. And so I'm very, very sensitive to that and how it changes over time. And, within the therapy, and also when the therapy is finished, like when that session is finished, how the voice just can change so much within the course of sitting down and all in between, and then at the end. And so I find that to be, really, really fascinating. So when people walk in, I am noticing their posture. I am noticing that, if they choose to take their shoes off, or they choose to leave their shoes on, then I live in California. And so often people take their shoes off when they come into someone's home. And sometimes they'll even say, is it all right if I leave my shoes on? And which I know, oh, this person is polite, but they're also a people pleaser. And so I have to make sure that I don't do anything that causes them to want to please me, because I don't want the therapy to be about me. So I will have these, these kinds of observations, and then noticing when they sit down, how they sit down. The chairs in my office are really comfortable. They're actually Eckernes stressless chairs. And Ernie and I used to joke, it's like, oh, the chairs that do the therapy because they're so comfortable. And they are like really comfortable. And so how is someone settling into a really comfortable chair? Are they using the ottoman? I mean, are they really relaxed, or are they tense and leaning forward and things like that within that initial kind of meeting? And I do pay attention to the posture the entire time within the therapy. That because people will slump, and then and that's okay. Sometimes the person's leaning to one side or the other, and when they go into trance, which can be induced or it can be natural, of when they go into a very, very still state, like almost a catatonic state. And then I'm just observing that. Then I'm observing when they start to move again. So I'm very, very big on the posture. Obviously, I'm talking about what I'm seeing first, and then I can talk about what Ernest would look for. And the other thing is that in listening very carefully to the words and how they're describing whatever it is they're describing, and I'm trying to determine, is this a visual thinker, If a person is leaning their ear towards me, then I'm realizing, oh, they're an auditory thinker. So sometimes these little subtle things of how they're using their eyes, how they're using their ears, and then when a person is within the course of therapy, are they licking their lips? Are they swallowing? Like, is there a sense that's going on, on the tongue? And as far as or the nasal goes, I haven't worked that out, but I don't think so many people learn by smell. I think that, smell is something that's a little bit different. And then people will sometimes, they'll just, they're like start kind of caressing themselves. It's really like this natural thing where, and then I'm realizing, oh, they're really, sensitive to the skin. And so between those kinds of things and then hearing their words, so to be able to utilize their words, but also bringing in, and where do you feel that in your body when someone is doing something like this? So I, without having thought about this really before, I'm realizing that that with this observational skills of how much it is that I'm paying attention to. Now, for Ernest, we never talked about this, and so I can't give it to you from his perspective per se. But when someone would come in, Ernest would really look at them, with soft eyes, but he would really look at them. He would really look at all of them. And so subtly looking in a person from head to toe, he'd really be looking at hands. He'd look at eyes first, and then he'd look at hands. And he would also, he was really, really good at, I'm going to use the word mimicking a person. So mirroring the person mirroring is a better term than mimicking. Mimicking sounds like you're making fun of them, and that was not the case. But he would mirror a person's behavior, and it was like subtle, but that was how he was tuning in with great sensitivity, that if the person is doing this and doing this, if their hand is like this, Ernie might do that, experiment with that. And he was one that followed rather than leading. So so he would have that kind of ability to be able to do that. And then once he had that kind of connection, he would really tune into his own body and what was happening with his own body. And he had a way that is absolutely impossible to describe in words. It's like you would have to have experienced it. But he would go into himself, only he was still connected to that client, and he would be in trance. Often his eyes would be closed. Usually they would be closed, and he would start to go into just whatever was happening on the inside of him, and he that was in relationship with the client. So he never repeated himself. That's why I know that it was involved with the client, not with himself. And it wasn't about, Ernie wasn't solving a problem for himself. It was just this, I don't know, psychic connection. I don't know how to describe it, but he was always spot on every single time. And so he'd go into himself, and and this was after mimicking and whatnot, or mirroring is the word I was intending to use. And then the client would sometimes open up their eyes to look at Ernie, and they could see that he was just completely into this. And it would usually be 20 seconds, 30 seconds, and then the client would close their eyes again and just go deep within. So that's like some of like, and being able to describe it. And it's a whole other situation in talking about looking at minimal cues via the 4-stage creative cycle. That's a whole other kind of discussion. But before going there, Jan, how about you in your observations?
Well, I mean, I got so much information from the two of you that, I'm thinking to myself, what could I possibly add to all that? I mean, it's so many things just enriched what I know. So I'm processing all that, but I'm not going away. I'm not escaping from answering that question. Just saying that it's like so much. And what could I add to it? Let me think about that. Well, I think what I'm doing many times is looking for patterns in the reactions people have. I mean, so sometimes I can I for example, I see the client or talk to a client over the phone, and so I can hear some kind of that they've got some habits concerning how they speak and things like that. Or for example, I see the client and he does something, or like a movement of some sort, or a reaction of some sort, a mimic, or some reaction. And I sometimes, and at one, so I can, one is that I can think about it in terms of what does it mean. That's one thing, but then I also put a kind of question mark on it, and just kind of keep in mind that I saw that once, and then when I see it the second time, I go, oh, there it is again. And so so things are repeating themselves, and then suddenly, so sometimes I just ask them, what happens right now in you, because I saw something like that. Or I don't even say that I saw something. I just sometimes ask them, what do you feel? What do you think about what's happening? And they tell me. And then sometimes I can see that it's kind of that it repeats itself, So they do something like, for example, move one eyebrow or something like that, and then that all those other things are connected with it. So sometimes, for example, I can see that when someone thinks about very difficult things in their lives, they have particular tendency to do some kind of, like mimics with their face or something. And then sometimes when I see this pattern going, repeating itself over and over again, I can ask them, okay, I can now what difficult thing goes through your mind? And people sometimes go like, how do you know? And it's just because I connect things in patterns, and I can see that things are sometimes repeating itself. So I'm very curious many times about decoding all these things that are not obvious but repeat themselves in this manner. Obviously, I also pay attention a lot to minimal cues and also non-verbal communication, but also what was very important to me when Dr. Roxana was, for example, referring to the way people speak, because I also focus a lot on that, since I also have a background in some CBT currents, CBT approaches. So, many times I focus also on how people talk about their problems, So there's a lot of matrices that you can use. Like, for example, I'm thinking, oh, this is generalization. This is, for example, something. So I'm looking for the distortions in their thinking. I also look for how they attribute causation to things, how they attribute control. Is it something that they are doing that is the problem, or is it something that is, for example, happening to them? So kind of things like that. And I'm thinking to myself, oh, so you are, like extracting control for the symptomatology outside. sounds like we've got additional thing to work on, so things like that. Sometimes it's just, from the way people talk about their problems. So I like, for example, in the beginning of the whole therapy process, I'm doing, so to speak, broad interview, so sometimes lasts for 3-4 sessions, about the problem, about the causes of the problem, about all those strategic kind of things, but also about past experiences and the life of the client, because then I can listen to how they are talking about their life, how they are talking about their the structure of their problem, and get additional information on what's actually in the structure and process of it, what's going on, because people kind of express those things in words. So that's kind of all those things that I'm looking for. This was another episode of our Experiencing Consciousness podcast. Thank you for being with us.
Thank you, Jan. You're the best. Be well, be happy, celebrate life.